Hello, everyone. My name is Dr. Vivian Asamoah. I am a gastroenterologist in Katy, Texas. I'm also a functional medicine provider. And if you are watching this live, thank you guys for joining me this evening. And it's probably because you're part of our tribe, the Natural Gut Relief Group. I am at home and you may see my kids in the background, so apologies if you do. But we run a Facebook Live every Thursday, and we talk about different topics related to natural gut relief or anything related to health and wellness in general. I'm a gastroenterologist, but my focus is everything related to natural gut relief and functional medicine. And today is another interesting topic. I wanted to talk a little bit about tests that we order. And this is going to be really laid back, guys, because it's a question that I'm asking myself. And so I'm putting the question forward, and I'm sure a lot of you have this question as well. So, as a gastroenterologist and a functional medicine provider, of course, I see people with abdominal pain and bloating and diarrhea and constipation. But one of the common symptoms that patients often come to me with is chronic fatigue. It's like I feel tired. Another one is brain fog, and a third one is cravings. And when you put the three together, it usually falls under the diagnosis of what we refer to in functional medicine or integrative care as adrenal insufficiency or adrenal fatigue. Now, when I put my conventional medicine hat on, I realized that for us to really make a diagnosis on what is adrenal fatigue, let me even first talk about what is the adrenal gland. It's one of those organs that I think is also underrepresented, unappreciated in conventional medicine, but is yet so important. And I hope everyone can hear me and see me. And if you can, just put in a hello or put in a whoop whoop. I see we have a couple of viewers, so thanks for joining me tonight. So the adrenal glands, again, are super important, but we don't hear of them a lot. We hear of the gut microbiome and the heart and the lungs and the kidneys and the gallbladder. But I think whoever talks about the adrenal glands, they're two tiny little glands that sit right on top of the kidneys, and they have an important, a huge function in the body. But in conventional medicine, we don't really do any testing to test for adrenal function unless, and even when we do testing, we don't find anything because conventional testing will only show us issues when the adrenals are shot, which is basically you're basically in adrenal fatigue, which is like failure, which is really bad, right? And so whenever our patients come to us complaining of chronic fatigue, brain fog, or even food cravings or blood pressure issues, we usually will just run regular tests. Very often we don't do any adrenal testing, right? Because we know we're not going to find anything. And we're like, oh, we didn't find anything. So this goes back to that cartoon, guys, that I showed on Monday, right? When our phone battery is like on 1%, like when my phone battery is on 1%, I start freaking out. Like, somebody give me a battery, right? But when our internal batteries, right, our energy level, our metabolism is down, there is no great test in conventional medicine to show us what's going on. Now, the test in functional medicine and integrative medicine is not perfect, but at least we can pick up on a trend. And this, I think, is some of the major differences between conventional and functional medicine. I feel like really sometimes in conventional medicine, we are figuring it out or we're finding a diagnosis when it's far gone. It's at the end. This is the final product here. Your adrenals are shot, or now you have rheumatoid arthritis, although we noticed your ANA was positive maybe 20 years ago. Oh, now you have rheumatoid arthritis. So we're waiting to treat disease, whereas in functional medicine, we are trying to identify and prevent disease from setting in. And that is why I think it's the combination of both and the best of both worlds that really puts things together. And again, guys, I know sometimes you guys are like, I'm like, oh, we got to order these tests, microbiome testing, micronutrient testing, stool testing, candida testing. And patients are like, well, it's not covered by insurance. It's not covered by conventional insurance. It's not covered under FDA approved testing. But all your FDA approved testing came back negative, but there's still something going on. How many times do I have a patient who comes in with a diagnosis of like IBS and we do our stool microbiome testing and we find stuff? We find parasites, we find candida, we find pancreatic insufficiency. And they're like, well, I've seen like 3 GIs, 4 GIs. I had like 5 colonoscopies, 2 EGDs, because they're not always looking for the same thing. So I have 9% on my laptop, but I really wanted to do this post go live today. With chronic fatigue, brain fog, craving, some of these are the first early signs of adrenal fatigue. And again, the adrenal glands are extremely important. I mean, I feel they are so underappreciated that I'm even like really disturbed by it at this point. Guess what? The cortex makes cortisol. Cortisol balances our entire metabolism, regulates to a certain extent our immune system, right? So insulin resistance, insulin balance, glucose balance, the speed of the function of your thyroid, connection with cortisol, right? And so the outside, so imagine that the adrenal is like a little kidney. The outside of the kidney is where the cortex is, and the medulla is the middle part. So the outside, the outer core is the cortex that regulates cortisol. That has everything to do with stress, how you deal with stress, your adaptive response, your fight or flight response when you're in a stressful situation, like you got a bad infection, COVID, for example, right? When you have COVID, your adrenals have to be on point to fight, meaning they have to have everything they need. They have to be in a good state to produce the cortisol response that you need. Guess what, guys? This is so interesting, right? Conventional medicine doesn't always think about this, but when our patients are in the ICU and they have sepsis and they're very, very, very sick, and we're giving them blood pressure pressors to sustain their blood pressure, one thing we often give to them is actually cortisol, because we realize that in that setting of acute stress, the adrenals are shot. They've gone into adrenal fatigue, right? So that is a connection that is made immediately. We give them cortisol and we see they actually improve, right? So why is it that when our patients are going through chronic stress in life, chronic everyday stressors, why do we not believe in conventional medicine that that can affect the adrenals and cause them to be secreting an imbalance of these hormones and these that are and neurotransmitters that are extremely important for everyday function? There's a problem. So we believe it in conventional medicine when it's extreme, but on a day-to-day, it's hard to measure it. We don't have the accurate measurements. And I think that's something that functional medicine and integrative medicine offers, right? So we do check when a patient comes in and says fatigue, all the symptoms that we mentioned and everything we mentioned in our post before, you can check how their cortisol pattern flows in a day. And this gives you a great idea of, what's their cortisol response. Are they overproducing? Are they not producing enough? Are they in failure? Are they deficient? And when is this happening during the course of the day? So you can see and then determine, well, how do we fix this? How do we fix this naturally through food? Because you can have foods that definitely help improve cortisol and adrenal function. How do we fix this through supplements? And how do we even fix this through cortisol stimulating supplements or cortisol replacement supplements, right? Even to a point where sometimes we'll actually use cortisol, right? Bovine cortisol, replacement cortisol tissue from beef, from cow. So we offer in functional medicine something that conventional medicine does not offer. We offer salivary cortisol testing and urinary cortisol testing, which I feel both are more accurate than just doing the blood work. So, and what's important to assess the cortisol flow to see, well, is this adrenal fatigue? Am I having some reduced adrenal response? Is what we want to do is we want to do, your adrenal response fluctuates in the day, right? So lower at nighttime, peaks in the morning. So you actually want to measure the cortisol, urinary or salivary, 4-point during the day. I mean, if you could get it measuring every 6 hours, that would be great. But typically it's 4-point cortisol, right? So you measure it right when you wake up, and then 30 minutes after is when you normally see a peak. then you measure it around 2 o'clock, then you measure it evening time. And there's a normal pattern it should follow. And when that pattern is off, you know that this person has cortisol, adrenal fatigue, or adrenal insufficiency. We usually don't say adrenal failure. Adrenal failure is sort of the extreme case that we see in the ICU. Now, in some scenarios, we instinctively know from the patient's story that the cortisol is going to be off. Classic example are patients who suffer from COVID infections. So post-COVID infections, we'll see cortisol is extremely low. Like it just plateaus, right? There's no rise. And so we can understand why somebody is tired even after they have slept 9 hours. They have drank coffee. They've eaten all the sugar they can. They're having salt and sugar cravings. They're still fatigued. It's because the adrenal gland is just not working well, right? Because the adrenal gland is affected by infection. So acute stress, like we mentioned, super sick, sepsis, ICU, burn victims. It's also affected by chronic stress, any kind of infection like COVID or Lyme or Epstein-Barr, anything that will affect the immune system. It is also affected by a hormonal imbalance, right? And equally affected by immune dysregulation and metabolic imbalance. So your diet can definitely affect cortisol levels. Your sleep can affect cortisol levels. Multiple things can affect cortisol levels. So today's talk is not really to talk about adrenal fatigue in its whole entirety. This is a whole talk on its own. But I kind of wanted to point out where sometimes conventional medicine is lacking and things that are so evident. The adrenals are such an important gland, such important glands that make important, very, very important hormones and neurotransmitters, the cortex making cortisol, and the medulla, that internal part, making everything that's adrenaline and even dopamine and even some sex hormones. But we fail to acknowledge this in conventional medicine when our patients come to us with all the triggers of adrenal insufficiencies, everything that could lead up to it. And the patient says, I'm tired. And we're like, well, all your lab looks great. So go sleep. This is where I feel functional medicine and integrative medicine does a really good job at saying, well, let's do these additional lab studies. Let's check your cortisol, or let's even assume your story fits, right? We've listened to your history. You're going through a ton of stressors right now. You just had COVID. Let's talk about working on that cortisol, working on that adrenal gland, and either through testing, so we have proof, but looking at your diet, looking at replacement supplements like vitamin D, vitamin C, zinc, extremely important, supplements like ashwagandha, looking at cortisol replacement, tissue, right, supplements as well, to see if this can help you restore your cortisol balance and your hormone balance in general, right? So that was the purpose of this talk, really to talk about the importance of sometimes getting this testing for symptoms that are kind of out of the box, but chronic, and conventional medicine has not been able to really identify anything. It is worth doing the test to really see what your profile looks like. And it's definitely worth working with a provider who understands the importance of connections in the body, right? Your body is not a bunch of separate organs, the heart, the brain, this all like, disconnected. Your body is one being, right? And the adrenals play a very important role here. And adrenal fatigue is a real thing, is one of the most common causes of chronic fatigue, one of the reasons being chronic stress, which is an epidemic in our society today, okay? To learn more about cortisol, salivary or urinary cortisol testing, you guys send me a message if you think this is your issue. We can definitely do the test. Or we could also just start looking into it and seeing what you can do in terms of life, in terms of balancing your life, your diet, your lifestyle to reverse this adrenal insufficiency and adrenal fatigue. That's all I have for today, guys. A quick back to basics on testing in functional medicine and a little bit on chronic fatigue and adrenal fatigue. Again, my name is Dr. Vivian Asamoah. I hope this came through okay because I'm having to sit outside my backyard. The family pushed me out. They're having dinner to record this. And we'll keep posting some information about adrenal fatigue. And we look forward to our live next week, Thursday. All right. Bye, everyone. Have a great evening. Enjoy your dinner. Bye-bye.